You can go to bed feeling just a little bit unwell and wake up fighting for your life. Meningitis moves with terrifying speed, turning a seemingly normal evening into a critical medical emergency in a matter of hours. Right now, health officials are tracking a localized outbreak of the disease in Kent, here in the UK. While the overall risk outside the area remains low, it is a reminder of how quickly this infection can surface. The infection targets the meninges, the thin protective membranes that surround the brain and the spinal cord. When the bacteria or virus enters the system, this vital shield swells and becomes severely inflamed. Viral meningitis is the more common type and usually clears within 10 days. Bacterial meningitis, however, is a life-threatening medical emergency. 1 in 10 bacterial cases is fatal. Because it triggers sepsis, a violent full-body immune response to infection, every minute reduces the chance of survival without permanent brain or nerve damage.
The bacteria rarely announces its arrival. It hides in the noses and throats of completely healthy carriers who show no signs of illness. Because it lives in the throat, the bacteria spreads through the direct exchange of saliva. In most cases, that means close personal contact, like kissing, but it easily hitches a ride on everyday habits. Sharing a drink with a friend or passing a vape back and forth creates a direct bridge for the bacteria to cross. Living in close quarters for extended periods, such as shared university housing, dramatically increases the likelihood of encountering an asymptomatic carrier. Since initial transmission is invisible and usually originates from someone who feels perfectly fine, your only defense is identifying the first physical warning signs. The countdown begins with symptoms that are easily dismissed as a common flu: a sudden high fever, and unexpected vomiting. Within hours, a severe headache sets in, alongside a neck so stiff that moving your head becomes agonizing. This is frequently followed by an extreme sensitivity and dislike of bright lights. As the infection overwhelms the system, the patient might experience profound drowsiness, complete unresponsiveness, or physical seizures. These symptoms do not follow a fixed order. Waiting for every sign to appear before taking action is a mistake that costs lives. There is one distinct physical symptom, a blotchy red or purple rash that appears across the skin. You can check the severity using the glass test. Take a clear drinking glass and roll it firmly over the spots. If the rash does not fade under the pressure of the glass, it is a clear indicator of a meningitis or sepsis emergency. But relying on this rash is dangerous. It often appears too late in the infection's progress, and in many cases it never develops at all. If you suspect meningitis, bypass your standard doctor. Dial 999 for an ambulance or go straight to the nearest A&E immediately. A patient's condition can deteriorate rapidly. Hesitating to seek emergency hospital care because you aren't absolutely sure is the quickest way to lose the battle. Once you reach the hospital, doctors will run rapid tests to confirm the diagnosis and determine if the infection is viral or bacterial. If it's bacterial, the patient requires at least a full week of continuous hospitalization. The medical team will deliver high-strength antibiotics and fluids through a direct intravenous line, supported by an oxygen mask. Even when treated quickly, survivors can face permanent costs: total hearing or vision loss, recurrent epilepsy, or the necessary amputation of limbs. Emergency medicine stops the infection, but it cannot undo the neurological damage already done. Preventing the onset remains the most effective defense. That brings us to our primary defense: vaccinations. They act as a shield to stop the infection before the biological clock even starts. The schedule begins for babies at 8, 12, and 16 weeks, with Men B and 6-in-1 vaccines. Toddlers receive pneumococcal and MMRV vaccines between 1 year and 18 months. Adults over 65 receive a single pneumococcal dose. Finally, MenACWY targets teenagers and first-year university students. While the overall risk outside the Kent area remains low, the rules for safety are clear. Maintaining vaccinations and reacting immediately to the first signs is how you outsmart a deadly timeline.